situation. Okay, now, sorted. Good afternoon. Thank you for the invitation. I'm going to try to let you know about the situation in Argentina from a dual standpoint. I've been a Minister of Social Development, as was pointed out. I've had to face public policies, and I'm currently a National Congress person, and I'm the President of the Disability Directorate. So I'm going to try and combine public policies and what they do in essence in terms of legislative matters pertaining to disabilities, as well as the debates that we have in Argentina. We have a big debate about where we're going in terms of disability policies or policies for people with disabilities. I'd start by looking at public policies for people with disabilities that have three general axes behind these. They're not the only ones, but they're three general axes. First of all, we're looking at the first block pertaining to income and pensions and access that families with disabilities have to the latter. The second aspect I'm going to talk about pertains to the different benefits that people with disabilities have in terms of health and who provides them, the state, the private sector, and how. The third has to do with social mobility and the dimensions in terms of education and employment, what kinds of public policies can include these social aspects with education and employment. I'm going to focus on these three axes in Argentina and the different conversations we have about this. In general, in Argentina, we have 5 million people with disabilities. According to the latest data, that is 11% of the population. Out of those, 1,200,000 people have access to pensions with no contribution, so disability pensions. In general, this includes 70% of minimal retirement. So that means there's access for a person for this pension and income for 70% of those that are part of the retirement program. This pension is debated in Argentina currently. The current government has taken steps back in terms of this program, and they've gone back to what we had in the 40s in Argentina, which is a pension for disabilities, work disabilities. So we've gone back from a pension to the concept of a pension only for people who have a work disability. So this is the debate that we're undergoing in Argentina now, and from a practical standpoint, it generates a lot of tension because we're reviewing around 1,200,000 people who currently have a pension. Essentially, I believe, I'm one of the people that think we have to do this the opposite way. We have to extend and render the pension scheme universal for those who have disabilities, starting with the foundation from an economic standpoint that a family or a person with disabilities has at least 30% more expenses than a family that doesn't have this currently. So the idea or the concept of a pension is only creating a balance in terms of the conditions. So there's a first debate around this in Argentina. There's a whole assessment process revolving around the pensions, where cross-referencing data, there's a current audit process. There have been difficulties for people who were getting a pension who clearly did not have a right to it, but there's a debate behind this. In Congress, as president of the committee, we've started a bill of law to render these pensions universal according to the rights of people with disabilities. But clearly there's a central debate behind all this. And I would say that this debate has a budgetary background behind it, looking at the budget of the national state to take care of people with disabilities. But there's a more in-depth conceptual debate, which is what is the role of the state, whether we have to have equal conditions and whether we can include pensions for disabilities for those with more difficulties, families and people with more difficulties, or whether that's not the case, and whether the state has to only compensate for people who have work disabilities specifically. So there's a first debate, which is quite an in-depth debate in Argentina currently, and I believe that the trend should be to actually extend or expand the pensions beyond just looking at audits and assessments. The second thing that we're debating currently is the benefits. What kind of access to benefits, especially in terms of health, medication, care, and treatment for people with disabilities should be about. There's a dual debate in our country currently. One, who gets this? The system in Argentina includes both public and private health systems, and there's a debate in the private system that tries to discard these benefits because they're costly, and this means there's an important matter when issuing these benefits, and this is debated fully right now. This has to do also with a mechanism used to generate these benefits, which is actually outdated in Argentina. In Argentina, currently, we have access through the public system and the private system for social works, and then there are institutions that render these services. Some are non-profit civil society organizations, and others are part of the private sector. All of these include some kind of benefits and nomenclature, and so there's an emergency law for disabilities that is trying to update this nomenclature. But there's a second debate that pertains to the type of benefits that need to be provided, whether we need to transfer the situation for some people with disabilities, whether we need support from an educational standpoint, access to medication. What kinds of benefits do we have to provide, and who has to provide them? In Argentina, everything is done through the health system. Even the educational health benefits are run through the health system, and many times the private sector, when doing this, debates whether it pertains to them or not. So there's an in-depth debate. There's a third dimension for this debate and discussion revolving around current public policies, which has to do with work and education. In Argentina, we have a mechanism and a law which means that there's a 4% vision for the public sector that needs to have at least 4% of people with disabilities in the public sector, which is an indication for the private sector, but it's not a compulsory law for the private sector. No public organizations have complied with this. I've been a Minister of Development, and we haven't managed to include this even in the social development program. I have changed my opinion in this regard. At the beginning, I thought that including a registration was stigmatizing people, but now I think it's a practical tool for employment purposes so that we can include people with disabilities who are seeking employment. And amongst the private sector, in particular in Congress, we have been working with human resources management to have integration mechanisms in the private sector. In Argentina, they have no clarity on how to interact with people with disabilities, how to look for these people, what kinds of skills they need to have. And this means different difficulties. In Argentina, we've had different masters and PhDs and academic aspects that have helped these processes, and we've had consulting to help. But in the educational system, this debate is even more profound. We have an inclusive education program, which includes people joining the mainstream schools for people with disabilities as much as possible so they can interact with the special schools. There are some provinces in Argentina that have included everything or encompassed everything under a single educational system. This is an in-depth debate pertaining also to financing, to funding. A student with disability in a mainstream school has an assistant. This has been badly funded in Argentina. They're getting paid for 180 days, so they're constantly looking for work, and there's a great level of turnover amongst these assistants. And we have a huge issue because the idea would be to have an assistant throughout the school year if you're with a student throughout the school year, and this is difficult. I'm going to talk about the other 2 points very quickly, but the point is amongst all three aspects, we have a conceptual, economic, budgetary debate. But also regarding pensions, I think they should be rendered universal, but currently the debate is whether we go back to a pension for work disabilities. And the second aspect has to do with the benefits that people have access to and how we can combine the public and private sectors and how we can start with a person who can appoint this. The nomenclature in Argentina, there's great problems with inflation and real access to inclusive education, which are all being debated. These three dimensions also include another two, which I'll look at very briefly. One is the actual scope of this in Argentina. In Argentina, the regulators of the people with disabilities were amongst the General Secretariat of the head of cabinet. In other words, there are different ministers that are looking at it. Lately, it's been under the health ministry. This is debatable, and I question it, because we have too much of a medical outlook instead of a social, all-encompassing outlook. This is a legislative debate, clearly, and I believe, and others believe, that we need to have instances that include all ministries and not just to reduce this problem of people with disabilities to a medical or medical treatment or support health aspect. The other aspect that is being debated is how we can generate a comprehensive mechanism and how these three dimensions, there are many others, but how these three dimensions can include a comprehensive mechanism and how we can have a law that can generate foundational conditions so that we can include all these three dimensions. This is fully being debated in the Disability Committee. I'm behind a few of the projects, but there are other people also with different outlooks to look at a minimal standard to see what the state has to guarantee, what is in the hands of the state, and then we need to look at the particular aspects of each government that faces the issue in one way or another. Then there's the third aspect, which is the comprehensive law that can regulate the situation in Argentina for access, for benefits and pensions, and health and education for people with disabilities. The current law in the system dates back to 1981. In other words, this was done by a military government in Argentina on the one hand, but aside from that, it's 40 years old. It's completely outdated, and that's why it pertains to a completely different reality. There's a debate on how to face this, and one of the aspects is to start to have a fixed percentage in the national budget so that we can regulate the disability system. It's not meant to be a debate according to the budget year after year. Instead, we need to look at the general aspects in Argentina. These are under the Disability Agency, and they need to have a fixed part of the budget. The debate is whether it's 2%, 2.2%, 1%. There's an in-depth debate, but in essence, we need to have a fixed percentage that can allow us to render mid and long-term public policies. That's what all the discussions are all about. We have an in-depth debate in Argentina regarding the way we can take care of people with disabilities. I would say, in order to close the conversation according to the time that's been allocated, regarding income, I think that we need to render the pension system universal. There's an in-depth debate regarding the health benefits that people should or shouldn't have, the role of the state, and I think that private and public health in Argentina generate this in-depth discussion in Argentina, and then we need specific and real inclusion. We need to look at how we help these people and how we include the special education in it. And the other thing is, aside from legislation in Argentina, we have to have real inclusion in employment in Argentina. There are several mechanisms and experiences. I've called the HR managers to Congress to have discussions and to share experiences. But aside from a few experiences, we haven't managed to have a scaled up public policy to include people with disabilities within the private sector employment. And so we need to have a clear and accessible registration process that can entail more opportunities. That's what I wanted to talk about. I hope this has been useful. It is currently a very important debate in Argentina to see where the system to take care of people with disability is going, who regulates it, what the state has to do and what they don't. And as part of this debate, I think there are many different aspects, interesting aspects that we can debate in terms of public policy and legislation.